Dr. Zorba Paster is here taking your calls at 270-9933. Good to see you.
We have three lines open, by the way. It's a good day to call if you have a question. Hi, Zorba.
We're just talking about Ray Liotta, the actor dying at 67 in his sleep. That sounds so unusual. He was so young.
Right. That's exactly what we think of. Right.
30 years ago, well, he lived a good long life.
That's exactly right. We have gained, since JFK was president, we've gained roughly 10 to 15 years of life, depending on what we're doing. Why? We're not smoking cigarettes. Many of us have not. At that time, 60% of the men smoked cigarettes. We're taking care of cholesterol, blood pressure. We're exercising more, and we're eating better. And the issues are, now that COVID is receding, it's time to go and get a checkup and think about what you can do to really have a long, sweet life.
A lot of people have put that off for a long time.
A lot of people put off, the cancer checks, checking for diabetes, checking for hypertension, everything else, and it really will make a difference. And so if you haven't been to a doctor in a year or 2 years or 3 years, now is the time to really go to your doctor, your PA, your nurse practitioner, and get checked.
And certainly we don't know what he died of, but it could be a heart attack.
Statistically, it's heart disease. I mean, we don't really know what he died from, but statistically, it's heart disease. And unfortunately, 1/3 of the people who have heart disease, their first symptom is sudden death. I mean, that's their first symptom because it's so asymptomatic for so many people.
Right. That's good. Get to the calls. We'll start with Alice in Milton. Hi, Alice. Go ahead. Alice, you there?
Yeah, I'm here.
Go ahead.
I want to know how long the boonshot lasts in your arm, and I'm in pain for 2 days with it.
How long the
booster shot?
Oh, the booster shot. It can last for like 3 to 5 days. You know, put a little ice on it. That would be good. Take some Tylenol, much better than an anti-inflammatory. You want to stay away from those unless you absolutely have to, but Tylenol is good. And, that's just, it's like a tetanus shot. Tetanus shots often hurt for a couple of days, too.
But the benefit far outweighs
there's no doubt about it. You are 60 times more likely to die if you get COVID, we now think, if you are not immunized. The number seems to be super high, so everyone should be immunized.
All right, let's go to Nancy in DeForest. Hi, Nancy. What's your question?
I'd like to talk to Dr. Paster about finding out if I need a shingle shot, even though I did not have chicken pox.
Well, the answer is, first of all, even if you didn't have chicken pox, you should still get a shingle shot because a lot of people who don't think they had chicken pox actually had chicken pox. So you can't tell for sure without actually getting advice from your physician, getting a blood test to see. But the answer is yes, you should get the SKF shingle shot, which is the 2-shot, and that particular shot is an incredible shot because it is 95% effective. The answer is yes.
All right.
All right, Donna in Baraboo, go ahead. You're on the air.
Yes, Dr. Paster, I was wondering what percentage of women age 87 get colonoscopies, and is that safe for women at that age to get a colonoscopy?
I got to tell you, that is a great question because generally, if you look at the recommendations from the federal government, it's to stop colonoscopies somewhere around 75 or 80, depending on which recommendation you're looking at. But a lot of people are living much longer, and the theory is that colon cancer is not going to get you, because you're older, you're going to die of something else. My recommendation is, if you're at risk, either get, if you have any risk or you're concerned, you can get the colonoscopy, or you can get the Exact Science Cologuard, which is just as good in the low-risk individual, and it doesn't require you going to sleep, anything like that. So
that's a good question.
Are there other medical concerns that, okay, you're this age, we're not going to worry about it?
Yeah, I think that's the concern.
Is there? I mean, there are other things.
The other concern is maybe you've got, something. Sometimes people look at age and they're ageist, and doctors do the same thing, and they go, well, you're old, you don't need a colonoscopy, you're going to die from something else. Frankly, I think that there's an ageist issue here. Cologuard, that's the way to go.
Yeah, that is the way to go. That's good news. Yep. And is it too late to get a booster shot if you haven't gotten one already?
Not at all. It is never too late to get a booster shot.
What do you think the fall is going to look like? Are we going to need another vaccine?
Well, right now the feds are looking at whether or not the influenza vaccine and the COVID vaccine can be put together. And that is some scientific issues, and we don't really know. It's in evolution. But my guess is we're going to need boosters just like we do for the flu shot.
And the thought is that our initial COVID shots that we got last year are no longer
well,
as
maybe,
effective.
right, because we don't really, and maybe you need 3 or 4 or 5, we really don't know for sure. But that's where medical information like we talk about on the show is so important, because this is good information. And as you know, everything on the net is not true.
Absolutely. Absolutely. All right, we're out of time. Thank you all for calling in. Zorba, thank you for your time.
Thanks, Zorba. Good to see you.
Pleasure to be here.
See you next time. We'll have a final check of your forecast coming up.